Hey, everybody. Welcome to Resiliency Radio, your go-to podcast for the most cutting-edge insights in integrative and functional medicine. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. Join me as we interview thought leaders, medical experts, and just interesting folks of all types, shapes, sizes, and backgrounds, hopefully bringing you transformative information to optimize performance and health and healing in your journey. Today's episode you will not want to miss. We're interviewing Nicole Bell, and I'll introduce her in just a moment. But I want you to think about this. What if the mysterious symptoms destroying your health were not all in your head, but a result of a hidden epidemic that medicine is failing to diagnose? Today, Nicole Bell is going to share her family's harrowing journey through tick-borne illness and the science that could change millions of lives. Stay tuned. You will not want to miss this interview. Before I introduce our guest, I just want to remind you that you can get products, services, and special curated sets and things for mast cell, for Epstein-Barr, for tick-borne infections, and you name it, your condition, gut issues at drjillhealth.com. So please pop on over, drjillhealth.com. You can get 15% off your first order, and you can find products and services that I have curated specially for you to help you in your journey wherever you're at. Okay, let's introduce Nicole. Nicole Bell is an author, entrepreneur, and advocate for tick-borne and neurodegenerative diseases. Her memoir, What Lurks in the Woods, details her husband's harrowing experience with a misdiagnosed tick-borne illness and seeks to help others navigate chronic conditions. Originally from Boston, Massachusetts, Nicole earned a bachelor's in science, and master's in science of material science and engineering from MIT, and a master of science in biomedical engineering from Duke. Nicole is currently the CEO of Galaxy Diagnostics, where she combines her professional experience with her passion to change the tick-borne disease landscape. So let's get to the show. Here's Nicole. Nicole, we had to try a couple times and reschedule, and I'm so excited to be here with you because you have quite a story. Um, you were a bioengineer, which is so interesting to me because that was my undergraduate degree. So you have this real science analytical mind, and then life took you on a journey. Do you want to tell a little bit about what happened in your life to get you where you're at today and the passion you have for understanding underlying illness, especially tick-borne disease?
Yeah, certainly. Let's see. So, my background, I'm an engineer by training. So, I have a background in material science and bioengineering. And I guess the other key thing about me is that I've always worked in small companies, pretty much. So, like I did my undergraduate and graduate degree at MIT. And right out of there, my professor was starting a company, and I joined, and I kind of caught the entrepreneurial bug really early on in my career. And then since then, I've kind of entered into the last half of my career has all been in medical devices and diagnostics, right? I kind of bioengineering, looking at solving problems that are making people well. And so I've taken lots of products through the FDA, and I really just like, bringing new innovations to the marketplace. And everything was going fine and dandy, right? I had a great career. I had two young kids. And then all of a sudden, my husband started becoming sick. And at first, I didn't really realize what was going on. So he presented with mood disorders. So he was depressed, he was irritable, he was, frankly, kind of a jerk sometimes. And then I realized that it was more than just, unhappiness. He was also forgetting things. Like he was also an engineer. He was brilliant, computer science, electrical engineering background, and all of a sudden he couldn't remember the four-digit code to our house alarm.
Wow.
And he couldn't remember the time to pick up the kids. It was crazy. It was like, well, you didn't tell me. Well, yes, I did. No, you didn't. Yes, I
Yeah.
did. Like you like feel like you're getting gaslit, but all of a sudden I realized he was literally forgetting basic things. And that was when I had to sit him down, this somewhat combative, unhappy, moody individual, and say, I think something's wrong. And I started researching, and tick-borne illness and Lyme disease in particular kind of was one of the first things that I saw. And we went to the doctor and had him tested, and he tested negative. And and then from there, I'll make a long story a little bit shorter. They referred us to a neurologist because a lot of his issues were cognitive. And then he was given a diagnosis of early onset Alzheimer's disease.
Oh,
And I was floored. Like I was still trying to figure out something was wrong and frankly trying to convince him something was wrong. And because sometimes when it's your mind going, you don't realize.
yes.
And then they were telling me that he was not only had Alzheimer's disease, but he was in the late stages of Alzheimer's disease, according to his PET scan. And as an engineer, I'm like,
And how
okay.
old was he then, Nicole, just for
He
reference?
was at first diagnosis, he was 59. So he
Yeah.
was older than I was, but he was
But
still
still
really young.
young, exactly. For we call yes, yes, totally agree.
Yes, and he was declining so fast and so young. And so I'm an engineer, right? I like root causes. And I'm like, okay, there has to be a reason why his brain is systematically destroying itself.
Yes.
And he had no genetic markers for early Alzheimer's disease. He had no comorbidities. And I just kept going from neurologist to neurologist looking for a reason, and we never found one. And then eventually, about 15 months after that first doctor's appointment, my brother called me and my sister-in-law had been diagnosed with tick-borne illness, and he's a doctor, and he started reading and he's like, you need to get him retested, right? Because these tests are not very accurate. And I think this is the root of his illness based upon all the research that I've done. And so sure enough, we went back, I got him tested, and he actually not only had Lyme disease, but he also had two common infections that go along with Lyme, specifically Babesia and Bartonella.
Yes.
And that was kind of when our whole journey with tick-borne illness began. So I'll take a breath there because
Wow, I'm so touched because, first of all, you said, I think something's wrong. And it takes someone, whether it's a family member or a doctor or a friend, to look at someone who's suffering and say, it's not just, we have these labels in medicine, don't we? Like Alzheimer's, ALS, Parkinson's, or just anxiety, depression, insomnia. And so often, especially these tick-borne illnesses, which we'll go into if you're listening, stay tuned because we're going to go deeper here. They present with mood disorders, with psychiatric diagnoses, and with cognitive decline. Those are the top three, and then fatigue's probably right in there. Fatigue, cognitive issues, and mood disorders. And they're real and they're severe. And it almost made me cry when you were just talking because you literally saw something and it could have just been like, oh my gosh, you just have Alzheimer's and then let's deal with it. And
yeah,
there's not a lot of answers. But you said, as a root cause kind of person like me, wait a second, what if there's something more? And because of that, obviously, you totally changed his trajectory. But how many people out there don't have that and don't have that curiosity? One last thing, and then we'll get back to you. In my documentary, we interview and tell the story of one of my long-term patients, Burke and Alyssa, and they're in the documentary, so their story's public. And he went from 16 years old to 36, like decades,
oh,
suffering, 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 suffering. And finally, just because he was gaslit, everybody said the tests are normal, you're fine, I don't know what's going on.
yeah,
And because he had such severe ulceration from the other viral infections on top of the tick-borne infections, his mouth was ulcerated. They started prescribing narcotics, and for a short period, he was addicted to narcotics. And again, it was just this whole slew of things that led to suffering. And he suffered in silence until he met his wife. And his
yeah,
wife was like, wait, this isn't normal, just like you. And again,
yeah,
those stories touch me so deeply because so many people are suffering out there and they don't know what it is. And if they just have a label, they can't get to how do we reverse that? So take
yes,
us on the journey from kind of figuring out, okay, there's a tick-borne infection and what you described is super common, the triad, right?
yep.
Borrelia and Bartonella and Babesia. So a lot of people are suffering from that. Where did you go from there? Because then it's still a complex journey. And then next, stay tuned because we're going to talk about why diagnostic testing is so complex and confusing, right?
Yeah. No, I mean, it really was a journey because it was an education for me. I mean, I was worked in diagnostics and so I understood that space, but the whole treatment space was definitely new for me. And so I had to dive in and I like to read research papers. And then I was trying to figure out, okay, what is this chronic Lyme? The CDC says it doesn't exist, at least at the time. They've since changed their posture, but um, but then there were a lot of research papers that said that it did, and I was just trying to navigate. I guess a little bit of a spoiler alert, my husband's journey doesn't end well, right? Like he was in the very end stages, of his cognitive decline. So we pursued all sorts of different treatment. We went to multiple Lyme specialists. He went on a pretty hardcore antibiotic protocol. And he did well for a while, and then he really started to decline. Then we switched to kind of herbal therapies. We did all sorts of alternative treatments, really embracing integrative, naturopathic medicine. But he had a lot going on, and I think that there were a lot of different infections that now I know were penetrating his brain
Yeah.
tissue, right? And so to make a long story short, we had a lot of up and downs. We treated for about 18 months, but he continued to decline cognitively. And so in 2019, I ended up making the difficult decision to put him in memory care. And then in 2022, he passed away.
Oh,
So, I mean, it was eye-opening for me how severe, these diseases really can be. And we're still in pursuit of answers even after his death. So I worked with a friend of mine. I've become embedded in the research community. A friend of mine helped me donate his brain tissue to one of the leading researchers looking at the pathobiome in the relation to Alzheimer's disease. We now know, and hopefully it will be published later this year, that we have, even after all the antibiotics and all the treatment, he still has evidence of Borrelia, or the bacteria causing Lyme, in his brain. He also has,
and this is
you know,
just let me pause for people listening because this is important. You're saying like pathologically, when they do the biopsies, they have evidence of the spirochetes in the brain. I think that's
correct.
important because I think there's got to be people out there listening that have been told by their conventional doctor this is all baloney. It doesn't really exist. You and I know
Yes.
differently, but to have a biopsy, specimen showing it is really a big deal.
Yeah, I mean, the traditional dogma is 2 to 4 weeks of doxycycline and you're cured,
Yeah.
right? He was on 6 months of broad spectrum antibiotics, including doxycycline, and he still has evidence of Borrelia in his brain. And there's been a lot of research from Tulane and other places really showing that these bacteria can persist even after treatment. They also found evidence of Babesia urticoliae in his brain, which is, as far as I know, will be the first published case of that parasite in brain tissue in Alzheimer's. They've shown it. Further research showed it in a young boy, but this would be the first one that's linked with an Alzheimer's case. And so, I think that we're still figuring out
Yeah.
all of the contributors to his decline. But I think the key that was really eye-opening for me is, Alzheimer's is not just some disease that you get and you kind of get the label and then you can decline. It's like there can be root causes, whether it's a pathogen, whether it's metabolic or whatever. I really kind of embraced a lot of this root cause medicine and trying to figure out, okay, why is the dysregulation going on, and what you can do about it. And I think pathogens play a bigger role in Alzheimer's and also other neurological conditions like, neuropsychiatric conditions. He was hallucinating. He was, his irritability, his rage, all of those symptoms are kind of hallmarks of things that I've seen in other Bartonella patients,
Yeah.
right? There's a
Yes.
lot of published research linking that pathogen to neuropsychiatric cases. And so it's just opened my eyes to the complexity of these diseases and also just the inadequacies of the traditional healthcare system that just said, like you said, they give it a label.
Yes.
They say you have Alzheimer's disease, come back in 3 months and we'll track your decline.
Yeah.
And that was the
Right.
status. So
Yeah. Hey guys, just a quick pause to remind you at drjillhealth.com, we have curated products to help you optimize your health and performance. And particularly in this episode, you may want to hop on over to drjillhealth.com and check out our tick bite treatment protocol. It's 3 herbal tinctures that have been proven to decrease the likelihood of transmission after a tick bite of the common infections like Borrelia, Babesia, and Bartonella. You can use this for 4 weeks after a tick bite and help reduce your risk of transmission. So hop on over to drjillhealth.com and check out the tick bite treatment protocol. Okay, back to Nicole. And as you talk about that, I'm often talking about functional medicine. Most of the complex chronic diseases, whether it's autoimmunity or cancer or neurodegenerative diseases, at the core, I find a toxic load and
yes.
infectious burden driving this immune inflammation and damage. And it's like the body it's trying to, even amyloid plaques we found now are a way for the brain to kind of cover up and try to take care of an infection in many cases where they find herpetic viruses or Borrelia or some mycoplasma, some infectious agent at the core where the body's just trying to take care of it, but it damages tissue along the way. And I feel like our immune system, whether it's autoimmune, all these things, often that's really the core, which is what you're saying. So one thing you talked about in your story that you have made a huge effort in your life to change was the difficulty with diagnosis. Do you want to kind of lay
Yes.
the framework for those out there who are like, oh yeah, because I get this all the time. I had a Lyme test at the local hospital, Quest, LabCorp, you name it, it was fine. Tell us why that could be missing the other infections or even a real infection with Lyme disease.
Yeah, so this is something that really is critical for people to understand, right? So if you go to your primary care doctor and you get a test for Lyme disease, the standard of care Lyme test, the publications as of recently would say that they're 40 to 60% accurate, right? So I used to say it's like equivalent to a coin flip.
Yeah.
The reality is there was actually just a paper, a 10-year study that was published last month by Bay Area Lyme and some other folks. They actually showed that at the diagnosis of early stage disease, it was about 23% accurate. So it's actually worse than a coin flip. And so why is that, right? And so the current standard of care test, it measures antibodies. So it's not actually looking for the pathogen itself. It's looking for the host immune response to the pathogen. And the problem with that is that Lyme and some of these other tick-borne pathogens, they're known as stealth pathogens. And so they are very good at evading and avoiding the immune system and actively suppressing the immune system. So some people do develop a robust immune response and they get the bullseye rash and they get, a fever and so forth. But a lot of people don't.
Mhm.
And the result is that you get a test and you test negative, and then traditional medicine will say, well, you don't have Lyme, and you might feel slightly better because you might actually not progress and have a traumatic response, but then over time you might have something happen and then that pathogenic burden continues, and it could be you get another infection, it could be you have a toxic exposure, it could be that you have a trauma, whether it's emotional or physical, and then that triggers the pathogen. And depending on where the tissue, like what tissue that the pathogen takes residence in, because these spirochetes have been shown to infect the tissue around the heart, they've been shown to infect the brain, the joints, like all sorts of different places. And so you get a whole different bunch of phenotypes of these diseases and the manifestations, everything from arthritis to neurocognitive decline to carditis. We
Yes.
have one story I talked about is Dr. Neil Spector's case. He needed a heart
Yes.
transplant, right? And
Yes.
so, and that's all because we're relying upon antibody testing. And this is not like, just think about COVID, right? Everybody got kind of a crash course in infectious disease diagnostics from COVID. If I want to know if I have COVID, I don't get an antibody test, right? Like that just tells you you've been exposed to the pathogen if your immune system is robust. But you get either a PCR or an antigen test to show whether you have an active infection. But the problem is because they're stealth pathogens and they're in low abundance, the traditional tests just aren't sensitive enough. So like a traditional PCR or whatever is not going to pick it up. And so that's the key. And as I kind of got on the other side of my journey, it was like, okay, well, there has to be, technology
Yeah.
solves key problems,
Right.
right? Like the standard of care test for Lyme disease has been around since, the previous century, right? Like I believe
Mhm.
in the 80s. And so it's like, well, what is the new technology? And that's really what drew me to some of the research at NC State and George Mason University that all kind of has been commercialized at Galaxy, which is where I am now to help say, okay, there are better solutions out there. It's just, knowing that what the correct approach is and then getting access to that through your doctor.
Yeah, thanks for explaining. Because again, still have patients that are very, very well read and trying to find problem or trying to find root cause. And maybe
Yes.
they've been told, oh, check for Lyme, but over and over and over again, they will come and say, yeah, my doctor tested and it was negative. And I say, well, which test? Let me see the results. And we go deeper, and often we do find that's the issue. I also loved what you said about immune system, because I always think of it as like most of us have had chicken pox, or if we're at a certain age, younger than me, we got the vaccine. I was above that age. And so people know about shingles. Everybody knows about shingles and the shingles vaccine. And that's just a reactivation of a virus that you got 20, 30, 40 years previously or longer.
Yes.
It just stays in our system. And when you hear that, if you're listening, it obviously makes sense because everybody knows about chickenpox and shingles. But we don't think about Lyme or Epstein-Barr or CMV or mycoplasma or any number of infections I could name in the same way. But the truth is, they are dormant and they can lie in our bodies. And I always say we could test 1,000 people on the street that were asymptomatic, and we might find 30% of them, I'm just guessing from my clinical experience, have antibodies to Borrelia. So they technically have Lyme disease, but they're fine. So what's the difference? And you alluded to that, and that's this stress or life situation or toxic mold in the home or some situation where weakened immune system, and then these things start to pop up and can become very aggressive. So we talked about labs. Let's talk a little bit about Galaxy and how did you come across? Because you talked about Western blot and kind of traditional testing and why it's not accurate. What does Galaxy do that these might be missing?
Yeah, so the approach at Galaxy is really focused on the direct detection. So antibody testing is what's known as an indirect
Mhm.
approach, right? Because your immune system has to respond in a proper way, and you have to have certain types of antibodies, and some people meet those criteria and some people don't. And that includes early stage disease and late stage disease. Like
Mhm.
my husband was clearly in late stage
Great. Yeah.
disease, but he still tested negative, as the case with Dr. Neil Spector, who I mentioned, where he was so sick with Lyme carditis, he needed a heart
Yeah.
transplant, yet he was still testing negative on
Yes.
the test,
Yeah.
right? And so direct detection is looking for direct evidence of the pathogen, and that could be either through kind of PCR testing, looking for the nucleic acids, associated with the pathogen itself, or it can be antigen testing. And antigens are different from antibodies. Antigens looking for a specific molecule associated with the pathogen. So and we use different approaches at Galaxy.
Mhm.
And so I guess backing up, when I was on the other side, I kind of looked, I'm like, okay, there has to be a different solution. There has to be direct detection is the answer
Yes.
across all other infectious disease, right? Like
Yes.
that is the standard. And I came across, I surveyed all of the other companies that are out there, looked at their technology, I looked at what was going on in the university space, and I came across research at both NC State and then George Mason University. So and they're different approaches, and we use them for different types of
Uh-huh.
assays. So I'll start with Lyme disease because that's the one
Yes.
that everybody's the most familiar with. So Lyme does not like to be in the blood, or Borrelia, the bacteria causing Lyme, does not like to be in the blood. During the early stages of the disease, while it's disseminating into the tissues, you might be able to capture it in a blood sample. But for the most part, once you've got disseminated disease, it likes to be in tissue. And so, the concentration is so low in the blood that the analogy I like to use for people who are not as skilled in diagnostics is literally the odds of catching it in a test tube and getting a positive with conventional PCR is about the same as your lifetime chance of getting struck by lightning,
Wow.
right? It's just a numbers game,
Yep.
right? It's like our founder, Dr. Breischwart, he always says like, look, if I take a bucket and I put it in the ocean and I pull up the bucket and I look in the bucket and there's no jellyfish in the bucket, does that mean there's no jellyfish in the ocean? Right? It's like, no, it's just a sampling error, right?
That's a great analogy. I love that.
Right? It's very simple. It's like it
Yeah.
has to
Yeah.
be in the tube,
Yeah.
otherwise you're not going to collect it.
Yeah.
And so what researchers at George Mason University figured out is that actually, um, part of the immune defense mechanism of Borrelia is that it likes to shed its surface proteins.
Hmm.
And it's kind of an immune defense mechanism because if you do have antibodies or you do have things in the immune system, they're going to attack the free surface proteins as opposed to the actual bacteria. The other thing is that, the bacteria likes to be in the bladder. Actually, in early research in mice, that's one of the ways they would tell whether a mouse was infected. They would harvest the bladder and
Yes.
then test the bladder with, PCR-based approaches. And so urine's actually a very good sample matrix for these, for looking at Lyme disease. And so they developed at George Mason this kind of capture and concentrate methodology where you take a urine sample,
Hmm.
you use a proprietary bead-based technology to basically capture these surface proteins that have been shed by the pathogen and filtered through your kidneys and into your bladder. And then you can take that capture concentrate and then detect it and see whether or not the pathogen's on board. And it's been shown to be great for early stage disease, and it also can be useful in late stage disease to show whether or not the pathogen's on board. Because the problem with Lyme is just like with my husband Russ, right? You can be treated and you can still have symptoms.
Yes.
And so the question is, do you still have symptoms because the Borrelia is still in your body, which
Yes.
obviously, according to Russ and a lot of published research, that happens? Or you might still be sick not because you have persistent Lyme, but because you have undiagnosed co-infections
Yes.
or immune dysregulation or gut dysfunction or anything. Because when you're sick with these pathogens, your whole immune system gets dysregulated. And
Yes.
so there's lots of reasons that you might still be sick. And so you can use this test to figure out, okay, is Lyme still front and center? And, is that something, or should you be looking at something else? And so that's the treatment or the testing modality that we're using for Lyme disease. For other pathogens that are often associated with Lyme, so specifically Bartonella and Babesia. And Bartonella is very much like one of those opportunistic infections, kind of
Yes.
like your example with shingles. It's like a lot of people get exposed to this. People don't realize how common it is. And then when you get something else where you're getting sick, then all of a sudden the Bartonella starts to raise its head.
Yeah.
Um, and so in this particular case, Bartonella and Babesia are bloodborne and you can get them in a test tube, but they are at really low abundance. And so you need some sort of enrichment technology or super sensitive PCR technique
Got it.
in order to detect it. And that was what was developed at our founders at NC State, really saying, okay, we're going to we use a proprietary culture media to grow the the Bartonella. And then we also use a technique called digital PCR.
Hmm.
And it's a better approach for these low abundance pathogens because if you think about it, right, you have blood and you have a ton of human DNA. And
Hmm.
then you might have a teeny bit of the pathogen DNA. And so looking for that with PCR is kind of like trying to find a needle in a haystack,
Yes. Yeah.
right? And with conventional PCR, you get one shot at finding that needle in the haystack. Well, what digital PCR does is it takes that haystack and it separates it into 20,000 piles.
Ah,
And then it interrogates each one,
that makes
right?
so much sense.
Yeah, so your signal to noise ratio is going to be a lot easier to find it in 1/20,000th, of a pile than it is in the big thing. And your signal to noise ratio goes up. And so you have a lot better chance of getting accurate detection. And so the work at NC State has really driven a lot of clinical discovery, both for Bartonella and now for Babesia. And it's showing that, their studies have shown that 65% of schizophrenia patients have Bartonella on board.
Yeah.
It's mind-boggling.
Yes.
And we have case stories. There's a story of a young boy that really started this investigation where all of a sudden he had sudden onset psychosis and he was homicidal and suicidal. And his parents spent like $400,000 on psychiatric care and he wasn't responding to treatment.
Yeah.
And fortunately, an astute provider noticed kind of these striae on
Yeah.
his skin that are associated with Bartonella. They referred him to Dr. Breischwart at NC State. They figured out he was positive for Bartonella. They treated him with the appropriate antibiotics and he got his life back. He graduated valedictorian of his class. He's on to college. And it's like, how many other of these, psychotic patients could get their lives back with the appropriate treatment? In
Oh,
Babesia, we're finding links to chronic fatigue syndrome and, things that are linked to neurological disorders. So there's so much there. We like to give labels that are
yeah.
easy, but the reality is so much deeper.
Oh, I love those sharing those examples. Not that I didn't love those examples, but because in clinic, same thing. We see a lot of OCD and rage and anger
Yes.
and insomnia and severe depression and suicidality. And I often do find another root issue. In fact, I've been known to say lately that I feel like I don't know if depression and anxiety, if there's any organic cases, meaning like not another cause contributing to it. And granted, there's hormones and metabolic and inflammation and infection and toxin and mold, and I could name 100 things. But at this point in my clinical career of over 20 years, I cannot think of a case of depression, anxiety, OCD, or even psychosis where I haven't found something else contributing.
Yeah.
And there might be some genetics that play into that, but it's still like I like talking about this because so many people feel hopeless and they feel
Yeah.
like this is just my label, this is my life.
Yeah.
It's not always that case. So thanks for sharing and thanks for your work. And just as a clinician, I've used Galaxy. I love it. And especially, I would say the most common time when I use it is especially for Bartonella because that one can be hard to detect. And
Yes.
as a clinician, if we do have clinicians listening, if you're out there and you have this high suspicion because it fits the criteria for Bartonella, but you're not finding it on traditional testing, that's always one I use. And maybe we should start using it as a first line. But in my
Yes.
experience, right, is that's exactly where I go. And I often find the evidence to support what I already suspected based on clinical suspicion. Um,
Yeah.
does that typically, so you're looking for this digital PCR? I loved your analogy. That helps me to understand, even as a clinician. Do you find that when someone's treated, so say this young man, he's very severe, he has a lot of, load of Bartonella in the blood, he's treated 6 or 12 months, whatever course of antibiotics. And as we talk about this, if you're listening, that sounds like a lot. These things are slow growing. Most of the time, they
Yes.
need more than 4 weeks. So you're going to
Correct.
be, yeah. So just to emphasize that. But back to this guy. So say 12 months later, he's finished treatment, he's so much better. would you expect a test that's negative at that time, or when do you typically see the convalescence of that infection?
Yeah, so with direct testing, we would definitely expect people to come back and have a negative result. One of the other things that we do is, especially for Bartonella, we do have antibody-based tests for Bartonella, and one of the things that we use that for is for treatment monitoring,
Yeah.
right? And so you might see as you go through treatments, the titers of your antibodies could rise and then fall with
Okay.
associated treatment. And so that's one of the things that we like to monitor and just see how people are doing. Um, but it's definitely, we've had many, many patients that go in, get the appropriate treatments. And that doesn't have to be antibiotics. We've got
Yeah.
many, many doctors that are using herbal protocols very successfully.
Yeah.
And so, there are treatment modalities that are effective. It's just really important to know what pathogens you have on board. Like going back to my husband's story, I wasn't really sure about his Babesia symptoms, right? And so we never really effectively treated the Babesia because he had Babesia antibodies, but we could never get a direct test. And
Yeah.
he tested positive for Babesia duncani, which is generally something that should have come up on a blood smear. What I realize now is that he had Babesia urticoliae, and it likely was not Babesia duncani. It was a cross-reactivity of the antibodies. And urticoliae is a very different species. It likes to sequester in tissues. It's in fibrin nests, and obviously it's now penetrating the brain. And so, not understanding truly what he had on board, he never really got the appropriate and proper treatment. And so that's the problem is like you really need to have accurate testing and antibodies, in addition to some people don't have them, they're notoriously cross-reactive.
Yes.
And so I see so many people that are coming in with these huge antibody panels and they've got so many things that are lighting up. And I'm like, I guarantee you, you probably don't have everything on that
Yeah.
list. You're likely getting a lot of cross-reactivity because once your immune system is hyperactivated, you're going to have antibody titers go up across the board. And then some of these antibodies are not specific to the particular pathogen, right? They might be cross-reactive with another one. And so you really need to be careful. And that's why I think, again, direct detection is the holy grail. It's like, okay,
Yes.
what do you have on board at this specific time? And how can we support that diagnosis? And then also kind of help you as you go through treatment.
Yeah, and you're such a gift to the world and to us as clinicians because this really is the conundrum, right? We often see these clinical things, and because of experience, we have high suspicion of certain things. But unless we prove, like for me, I'm a scientist at the core, so I want to know that I am actually treating what I think I'm treating. I don't typically just give things randomly. And I
Right.
love that you said besides drugs, because a lot of my patients are on herbs. There's so many good. I kind of want to emphasize that if you're out there listening, it doesn't have to be antibiotics. I actually have, I would say more people respond to herbs in the right combinations than antibiotics, actually. So they're
Yes.
both used, but it's a clinician's, prerogative to try to decide that. Interesting too, just in my clinical experience, this may or may not be relevant, but when I do a classical Western blot or eye blot or any of those, band 41 can kind of be ambiguous, but I often see that cross-reactivity to tick-borne relapsing fever and
Yep.
especially Borrelia miyamotoi, which is just kind of like the equivalent of your Babesia example, where there's this weird strain, more
Yeah.
common where I'm at in the Western states, but a lot of doctors or even CDC kind of places will say there's no Lyme in Colorado where I live, right?
Yes.
I see it every single day.
Yeah.
Um, Let's talk really quickly about that myth of where like Lyme, it's only Connecticut, it's only, and then I want to go to your personal story at the end here. But before we do, let's just talk just briefly about, do you want to bust some myths about where Lyme is in the states and why it really can be found about anywhere you live?
Yeah, I mean, I think if you look at the tick maps and the disease maps, there are definitely hot spots,
Yes.
right, that are
Yes.
worse than others.
Hmm.
But I think that, it's really in all 50 states.
Yeah.
And I think the other thing that I like to remind people is it's not just about Lyme disease, right?
Yeah.
Like, in North Carolina, especially in the western part of the state in the mountains, there's higher incidence of Lyme disease, but there's also higher levels of ehrlichiosis. And we're also seeing a lot of people starting to develop like alpha-gal,
Mhm.
which is an allergic type syndrome from the Lone Star tick.
Yeah.
And then babesiosis is also rampant. And recently was just some articles that showed it's kind of expanding in the Maryland, Virginia area. And so there's so many nasty, it's like I call ticks are nature's dirty
Yes,
needle, right?
yes,
Like there's so
exactly.
many things that you can get,
Uh,
including, and I'm just talking about the bacteria and the protozoa, right? There's also a whole bunch of viruses that you
right,
can
right.
get that are
Yeah,
pretty terrible. And so I always like to tell people it's like, okay, if you get bit by a tick, if you know you got bit by a tick, right, save the tick, get
yeah,
the tick tested so you know what you're exposed to. I
yes,
think the traditional medicine will tell you, well, testing the tick doesn't really matter because it doesn't mean it's passed on to the person. That's hogwash, right? Like you want to know what you could potentially have been exposed to so that if you're going to the doctor, they can test for the right things. Doesn't mean you have it, but you've been potentially exposed. And then yeah, I think it's all over. And a lot of people, most people actually with chronic Lyme don't even remember a tick bite. So a lot of people, like some of these, the nymph
yep,
ticks are
yep.
really
I
small.
know.
And so people are like, well, I've never been bit by a tick. Well, most people with chronic Lyme disease don't remember being bit by a tick,
Yeah,
right? 14% of people get that traditional bullseye rash, right? Like you go to your doctor, they're like, well, you don't have a bullseye rash. It's like, okay, doctor, only 14% of people get that
yeah,
bullseye
exactly.
rash. And then another, 30% of people don't get any rash at all,
Yeah.
right? So it's like, and then in between, there's all sorts of different types of rashes that might get misdiagnosed as other conditions. And so I think that general awareness for clinicians about, accurately understanding these pathogens and the risks that are associated, that's what leads to a lot of these problems. And if you don't catch it early, then it disseminates and it progresses to super complex chronic illness. And we have, to your point about them being on board, like I can't even tell you the number of stories that we've had. It doesn't have to be something traumatic. It can be, I mean, I'm at the age where it's like hitting perimenopause, right?
Yeah,
And so
yeah,
I can't tell you how many people that we've had providers where a woman like myself goes into the doctor starting to feel fatigued and just says, oh, I have perimenopause. I need some help. I want to kind of get optimized. And then, the clinician does a good history. They realize there was a prior exposure to Lyme disease.
yeah,
They run our test and they find out that, the person's positive. And it's like, well, yes, you probably, your hormonal shifts
yes,
have caused your immune system to be, suppressed. And therefore, now you're getting a resurgence of this past infection, some of which, like we have at least a few examples where this person was infected back in college,
yes.
right? And so, always keep these things in mind. And it's not always, so simple.
Yes, I really like that you mentioned hormones because years ago, so I grew up in Illinois and hiked in Wisconsin, and I pulled ticks off many times. And I have tested positive very clearly many times for tick-borne relapsing fever, Bartonella, Babesia, and Ehrlichia. So I definitely have a bunch of them. They're under control. I'm doing fine. However, I remember when I hit, menarche around 12 or 13 years old, and then from that age until my early 20s, every cycle I felt like I would get sick. Like I had these
Yeah.
like things where I would get, or if I stayed up too late one night, I'd get sick. I was really prone to that, and it was always around my cycles. Well, later on, I realized that that life cycle of the Lyme plus the hormones often would cause a woman in their menstruating years to feel this like cyclical up and down based on their cycles.
Yes.
And I think it was totally related to those infections because I'm pretty sure I had them from quite young, maybe, 10 or 12 years old. So I like
Yeah.
mentioning that because otherwise you're like, what is going on? And it's a good reason if you really are getting cyclically sick, that you should be tested and then just, treated. And there's some lots of nice natural ways. So in our last few minutes, you wrote a book, What Lurks in the Woods, and in
Yeah.
that book, your memoir, you talk about, caring for your husband and all the stuff that you went through. And I want to talk on the personal level of like, what is it like with this complex chronic disease and then having your husband in memory care and then his passing, just from those listening, because I know there are a lot of people suffering and there's a lot of listeners who have loved ones suffering. And before we jump in, I just want to also mention there's a couple documentaries. Let's see, Quiet Epidemic is a really recent
Yes.
one that's really well. It talks about the heart transplant of Nicholas, is it right? The
Dr.
doctor.
Neil Spector.
Yes, Neil,
Yes.
thank you, Neil Spector. And so that's, if you want to know more, you can go watch Quiet Epidemic and Under Our Skin, I think is the other one that had been around a while. You might know some more, but I just thought for people wanting to know more, you can
Yes.
watch those movies. And actually, my documentary, Dr. Patient, is also talks about two patients with Lyme, so that's a big theme there too. But anyway, back to your book, your memoir. Do you want to give some last little insights and tips and like how did this journey affect you? Because the difficult personal journey is you dealt with this, you dealt with your husband who was really dying. And it's hard
Yeah.
to say that. And how was that? I can't even imagine. And my heart goes out to you.
I mean, look, I've done a lot of hard things in my life, but being a caregiver was by far the hardest thing that I've ever done. I mean, I'm pretty strong. I'm a Boston girl. I'm pretty
Uh-huh.
tough. I mean, it almost broke me. I mean, it really did. We had two young children. I mean, when my husband went into memory care, my children were 5 and 8.
Oh,
So the whole time that he was really sick, they were very young. I was still working. Um, it is so hard. And I have a background in engineering and in the medical science, not in medicine, but at least in biochemistry and immunology. Like I did studied all those things, but navigating the minefield, particularly in tick-borne illness, where it's still the mainstream medical community is really not educated properly in terms of the latest research, is really difficult. And then I had, my husband was belligerent a lot of times and trying to, be compliant with care. It was it was really hard. And so a lot of these patients that we interact with at Galaxy, I have the utmost empathy for because some of the stories that we hear, particularly these neuropsychiatric cases where people, their brains have literally been hijacked
yes,
and they are not the same person that they once were. And it's through no fault of their own, right? This is
yeah,
like a pathogen that's inside kind of driving the bus.
yes,
And it's crazy because it leads to, and there's been so many documented cases of homicides, suicides, hallucinations. Like I lived with it. I mean, like just as one small example of something that we went through, my husband was the most logical person in the universe, right? Like literally computer science, electrical engineering. He came in one day and told me that there was a man in our woods swinging from a vine from the trees with a machine gun. And he was fearful for his
oh,
life. And you're just like, how do you respond to that? Right? Like you're like, okay, let's just calm down. But he was like panicked because it was
yeah,
so
so
real to
real.
him. He thought there were people living in my woods trying to kill
Oh,
us, right? Like
yeah,
this was so real to him.
yeah,
And I can't even tell you how many other patient stories that we've heard where, everything just gets turned upside down and it really literally destroys families because financially, emotionally, like, the structural relationship, people get divorced. It is the hardest thing. And to me, it's crazy because it's all avoidable,
yeah,
right? Like
yeah.
an accurate diagnosis and an accurate treatment, and all of that can go away. And so really that's our mission at Galaxy is to change. It's not just to provide a better test, right? We want to change the standard of care.
Yeah.
We want to go after and we want to make our technology wildly available, get it in the hands of, the LabCorps and Quests of the world,
Yeah.
really get it not only for people that have a suspicion of tick-borne illness, but also for people that are just sick and they don't know why, right? Like anytime somebody has a neuropsychiatric condition and they don't respond to treatment,
Hmm.
I'm always like, have you
Please
thought
test.
about tick-borne disease? Like,
Yeah.
same like a lot of kids out there with, pans pandas and kind of neuropsychiatric OCD, anxiety that comes out of nowhere. I mean, so many kids where they were just doing great in school and all of a sudden they crash and they can't leave the house because they have so much anxiety. I mean, think tick-borne disease, right? Like these are things that are warning signs that if you're in this business, it's like it's so obvious. It's like a big neon sign over your head, but for traditional medicine, it's not. It's like you give a label, oh, you have pans pandis, like we can try and, dampen some of the symptoms or they're not even that aware and give it some other diagnosis. And so, or it's just how your kid is or whatever it is. And so I think that's the mission that we're on is to really change that environment.
Well, Nicole, first of all, it's been a pleasure getting to know you better. And I'm sorry for all the difficulties you've gone through, but I always have such admiration for those people like you who take that and transform it in the world and change. I mean, there's many, many, many thousands, if not tens of thousands of lives that have been changed not only because of your lab, but because of the suffering you had to endure and then transform that into knowledge. And I'm just so grateful for that and for the work that you do. Any last bit of wisdom if someone's out there and saying, huh, I wonder about me? Two questions. Number one, is this available to the public? Do they need to ask their doctor? Like, how would they get a lab order? And then where can they find you and get more information?
Yeah, so we offer testing services today, and so you can reach out to your doctor, and they can set up an account and order testing. If your doctor's not willing to do that because they're not open-minded, then I would say try and find another doctor if you can. Or if you really are having trouble, you can reach out to we have a clinical team that will help support you and help find a doctor that can at least order the test. We have information on our website, which is galaxydx.com, and we've got accounts on Instagram, Facebook, LinkedIn, where you can follow what we're doing. I think part of our mission is not just the diagnostics, but it's also part of the education.
Yeah.
And so we like to share the latest research. We are working with clinicians and providers like yourself to share information, not only on the diagnostic side, but also provide an environment where people can share what they're where they're finding success from a treatment perspective, where they're seeing these pathogens linked to, certain resource or certain conditions and so forth, really fostering as much research as we can so that we can bring light to these really difficult diseases. So happy to help people, reach out on our website. We have a contact email address, and we'd be happy to help if people need some support.
Beautiful. Well, thank you again for your time today. Thank you for transforming your story into something that really has helped people, and just to continue to appreciate the work that you're doing, Nicole.
Oh, thank you so much for having me. It's been a pleasure.
Hey, everybody. I hope you enjoyed that episode with Nicole Bell. Really enjoyed deep diving into tick-borne infections, how common they are, how devastating they can be to those of you who know a loved one suffering, and how diagnostic testing is really, really critical and good, accurate testing. So I hope you enjoyed that, learned something new. And please hop on over to drjillhealth.com. Be sure and check out all of our products and services we have for you, whether you're suffering from mast cell activation, Epstein-Barr reactivation, fatigue, or histamine reactions. We have all the solutions. And especially if you are in a tick area endemic and you have concern about tick bites or getting treated if you do get a tick bite, or your child or someone you know or love, be sure and grab the tick prevention treatment protocol. It's a combination of 3 herbal drops and tinctures that can be used to prevent Lyme disease after you've been bitten by a tick. They do cover some of the co-infections, so it's a great thing to have on hand in your cabinet. It's the tick prevention treatment protocol, and you can get it at drjillhealth.com. All right, guys, we'll see you next week for another episode of Resiliency Radio.